Hello, my name is Emma Pettey with CBM Global's Emergency Response Unit. I'm here today to talk a little bit about the findings from the rATA, which we recently conducted in the Rohingya camps in Bangladesh. As a little bit of a background, the rATA was conducted with REACH, and it covered all 34 of the Rohingya camps. Prior to the rATA, REACH had conducted an Age and Disability Inclusion Needs Assessment to collect data on the prevalence of persons with disabilities in the camp. Respondents for the rATA were randomly selected from those who reported some difficulty, a lot of difficulty, or could not do it all in at least one domain of the Washington Group questions on the ADINA, or a lot of feelings of anxiety or depression are reported on a daily basis. Prior to the rATA, training was provided by REACH and our local partner, the Center for Disability and Development, for the enumerators. Data was collected from 401 household surveys with 666 individuals. Remote data collection was done through phone interview and proxy for individuals under 17 and adults who were unable to respond on their own behalf. It should be noted that this was the only rATA which was conducted in a humanitarian setting. So some of the key findings we wanted to talk about was around the use of assistive products. So of the respondents, 11% reportedly used assistive products, and the demand for assistive products increases with age, with 36% of older persons reportedly using assistive products. This number of users of assistive products was slightly higher among the male population. We also noticed that persons with functional limitations reportedly had higher use of assistive products across the different domains. The top 5 assistive products used were spectacles, auxiliary elbow crutches, shower and bath chairs, cane sticks, tripods and quadrupods, and pressure reduction mattresses. We wanted to touch a little bit on some of the interesting findings and that we're digging a little bit further into at the moment, which came out of the rATA. One of them was around the sourcing of assistive products. We found that 26% of people reported that their assistive products were self-made, and quite a few people had sourced assistive products from family or friends or the private sector. And in terms of payment for assistive products, over 50% of people either paid for it themselves or from their family and friends. So what we are looking at in some further research is what type of products are being made and why are people having to make them themselves, how people are paying for their products. If they're paying out of pocket, are they having to borrow money? Is there interest involved? We're also trying to look a little bit more into the local market for provision of assistive products. What sort of assessment is being done if people are purchasing their products in the local market, and what sort of training is provided on use and maintenance of those products. Another interesting finding that we had was around the suitability of the assistive products, with 65% of people reporting their products were moderately suitable and 43% reporting that they were moderately useful for the environment that they were in. So we're looking at this further research. We're looking at how have the assistive products impacted the user's lifestyle and ability to participate in their ADLs, and how could the product be better improved to suit the needs of the user and the environment in which they live. Other findings that came out were around the demand for assistive products. Found that while 1% of people surveyed had their needs met in terms of assistive products, 51% of people reported unmet needs. These people with unmet needs did increase with age, although was fairly similar between males and females. And we found that quite significantly across the functional limitations, persons were reporting a need for assistive products. The top 10 assistive products that were needed included spectacles, shower bath and toilet chairs, auxiliary elbow crutches, the pressure relief mattresses and cushions, as well as hearing aids. So within the Rohingya camps, we're estimating that at least 50% of people have not been reached by rehab services or assistive devices, with the provision of rehab services and assistive devices being left to a few specialized agencies. The Age and Disability Working Group in Bangladesh is currently working on advocating for rehabilitation as an integral part of primary healthcare within the camps. And so the data from the rATA can be used in order to help the advocacy efforts of the ADWG in really demonstrating the demand and the unmet needs that still exist in the camp for assistive products. So thank you very much. If you have any further questions, please feel free to contact us at emergencyunit@cbmglobal.org.